My article is called Effects of a Mindfulness Activity on Nursing Service Staff, Perceptions of Caring Behaviors in the Workplace. Mindfulness to care for others in the workplace can start with mindfulness activities at the beginning of each shift. Perceptions of caring attitudes were analyzed in a mixed method study. Using a mindfulness activity, the effects of less stress and more patience across the shift was seen. Nurses remember to put more care into their work when they can take a moment as a community to regain focus, shown in pre and post surveys in this article. This promotes nurses wanting to set a good example, to put their best foot forward, to help others, and to be more patient. When nurses are more positive and focused, there is a decrease in nurse incivility in the workplace. The article started off with a literature review. OSHA, the Occupational Safety and Health Administration, found in 2016 that over a 12-month period, over 50% of nurses and nursing students were being verbally abused in their workplace. Watson's 2008 theory of human caring, which is shown in this article and multiple times in this project, has been the primary focus for many clinical policies and efforts to decrease incivility in the workplace. The theory focuses on 10 Caritas processes, which are factors that involve unconditional love. The factors have been used to find practices that increase caring behaviors, one of which that we will focus on is mindfulness activities. The method involved 164 participants who were used for the study using a convenience method, a convenience sample in which participants who were used were interested and were randomly selected from each department. There were 118 RNs, 21 LPNs, and 25 CNAs. There was a treatment group from 9 departments and a control group from 10 departments. The procedure. Each participant was met with the research members and talked about what mindfulness meant to them before learning about the activity that they would take part in. They each took part in a 1-minute mindfulness activity, followed with a caring behavior such as a written compliment to others, offering a coworker help, and active listening to other coworkers. This happened 3 different times during their shift for 3 consecutive shifts, and at the end of them, they completed a 7-item qualitative study. 5 items from Watson's theory were used along with 12 others from the researchers to make a 17-item quantitative instrument to assess perceptions of the extent of caring behavior in the workplace. Each one was a nurse's behavior judged on a Likert scale by each nurse, such as, I trust the nursing staff I work with, and nursing staff I work with are distant with me. There was also a qualitative study done with survey questions to analyze personal nurses' experiences and their responses to the study. The results were ultimately positive. Quantitatively, the treatment group's caring behavior score was significantly higher than the control group's score. Qualitatively, 3 main themes and 13 sub-themes emerged from the data as shown in the next slide. These themes show how heavy the workload can be and how actions speak louder than words to help each other throughout the shift. That was a common theme, that actions speak louder than words and that they all wanted to work as a community. It also shows how the mindfulness caring activities increased cohesiveness, it increased positivity, and helped relieve stressful work environment. This article was very pivotal in our project and developing a policy to help change lateral violence in the workplace.